Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and committed to being part of the change that Cayman so desperately needs. Join Sandy Hill. Bigger, better, bolder.
People talking. What are they talking about?
Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and commit.
Good morning. How's everybody doing? Why am I not coming up on the microphone? Can anybody hear me? Shamari, can you hear me this morning? You can hear me. Oh, okay. For some reason, I don't see things moving on my screen, but I will just assume that I can be heard. Let me look at my messages. Normally the little voice thing is moving and that's not happening. I can hear you. Okay. All right. Everybody else can hear me. Then we are going to get this on the road and jump back in. All right. Let me see here now. Good morning. All righty. Today is Tuesday. Good morning to one and good morning to all. Of course, we're going to be bringing you all of the latest updates. And we have a little bit of a special segment today. Hopefully, they'll be joining us. It's the McField clan. They're going to be having a reunion. So that sounds interesting. So we have some members, including Mr. Steve McField, who are going to come on and tell us all about that. It's a very big family, I must tell you. So if you think you might be a McField, then you're going to want to stay tuned and learn more about this family reunion, how you can participate and learn more about how to fill out the family tree. Before that, it is Medical Rundown Tuesday. We are very, very pleased to have in the studio with us, Mr. Shamari Scott. So let's go ahead and welcome Shamari in. Good morning, Shamari. How are you?
Good morning, Auntie Sandy. How are you doing?
Oh, no, I can't hear you.
You can't hear me.
Oh, boy. All right. So something's going on with my...
Hold on 1 second.
It's got to be me with my setup this morning.
No?
So, Shamari, give me a second because I can do without hearing myself, but I can't do without hearing you.
Okay.
So give me 1 second. I'm going to play some music.
All right.
And then I might have to just close my browser and reopen it. All right, let's try that.
No problem.
Otherwise, I'm going to be forced to try to read lips, and that's never a good idea. Okay, give me 1 second, folks. Let's see what we can do.
Good morning, Auntie Sandy. Can you hear me?
Good morning. Yes, there we go.
All right. There we go.
My little audio thing is visible as well. The little audio fluctuations around my emoji con. All right.
Good.
Yes, I can hear you now. Phew.
I was wondering if you had lost in pickleball and you didn't want to discuss it. Why you were active.
No, 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 man. I'm having to take a little break. I'm hoping I'll be ready again by Tuesday, but the orthopedic team at HSA, they're going to be my best friends real soon because that knee, woo, it's
I I I understand. I
it's giving me
understand.
a warm time. But I'm not going to give up because I think the exercise sometimes, it's hurting, and I go out there and I play a little bit, and it
Mhm.
feels better after I play. So I'm like, I gotta keep on top of it. So good
Well,
morning, sir.
anytime I play, my ankles hurt. So
Oh man,
I never had too much ankle issues previously, but I guess once you reach a certain age, then everything that
yeah.
happened before comes back to haunt you. But
I
I
know.
played through it. I played through it.
Exactly. Sometimes you got to kind of push it just a little bit, but I am having a chronic flare up at the moment. So I'm resting this week,
Right.
somewhat, but yes, not to worry, not running from Andre. Only on the pickleball court am I running from him. But thank you so much, as always, for coming on the program and educating us. And of course, today is like every other Tuesday, where we are going to learn something new and interesting. And you've got some of your experts here who are going to be joining us, really filling out the team extremely well, I must say.
Definitely. And today's an exciting day because we're going to be introducing our interventional radiologist.
Mhm.
And it's a very interesting area, and a lot of times people don't quite understand what a radiologist does. And then when they get to understand what an interventional radiologist is able to do, they're like, wow. So I'm really excited that we're going to have Dr. Anil, who is going to be joining us. Highly skilled. He's specialized in minimally invasive image guided procedures. So he's going to be able to explain that. He's an expertise in vascular and non-vascular interventions, and he's worked at some of the leading institutions globally. And one of them, for instance, would have been Tata Medical Center, which is one of the world's largest cancer centers. And Sandy, as you know, when you get physicians from facilities that have numerous cases, the expertise level is higher. They've seen a lot. They have a lot of reputation. They call it practicing medicine, and the more you practice, the better you get. And he's had a decade of expertise post MBBS. And he also specializes in different areas from oncology, gastro, obstetrics, dialysis, pulmonary, musculoskeletal, breast, and the list goes on. So without further ado, we'll definitely ask Dr. Anil to join. So
And
he
I
can take
think I
us
just
through.
made, can I just correct myself? I think I just made a little slip up. HSA and HCCI, sometimes they both begin with H's. No, no, no. I meant to say HCCI because Dr. Naranjan is my guy.
I
So,
was thinking Dr. Naranjan is going to get jealous
oh
hearing
my goodness. No, up to after yesterday, I messaged him and I said, Doc, I'm having a little bit of flare up. What should I do? And he gave me some advice. So, and I'm doing my physio and stuff as well. But yeah, no. Yep, yep. He's the one.
don't,
Trust me.
don't make Dr. Naranjan jealous.
I know. I know. No, he's absolutely fantastic. Um, so wonderful. Interventional radiology. Well, let's bring Dr. Anil in because I have no idea what that even means. So I think I'm going to be a top student today. Dr. Anil, good morning. How are you?
Hi, good morning, everyone.
Yeah, so nice to have you here. So, can you tell us what is interventional radiology?
Yeah, intervention radiology is a medical subspecialty that basically uses a minimally invasive imaging techniques to
Mhm.
diagnose and treat a wide range of diseases. It is a well-established subspecialty branch in radiology, and it has taken a shape from 1960s.
Mhm.
A breakthrough through a percutaneous angioplasty where we put a wire inside the artery and try to open up the block. And since it has become a recognized subspecialty, and it allows doctor to diagnose, treat a variety of the health conditions without the need for any open surgery.
Hmm.
Intervention radiology is often called as a keyhole surgery or a pinhole or a stitch-free surgeries.
Oh, wow. Okay. Well, we're going to learn some
Most
more
of the
about,
procedures are done under daycare. Yeah.
yeah, we're going to learn a bit more about what this is and how it works. But I see that you have some very interesting areas of expertise. So, does this mean that all of these areas you can use interventional radiology?
Yes, definitely yes. From
Oh,
head to toe, we can use intervention radiology techniques to treat most of the types of diseases
huh.
without a need for surgery.
Wow.
And and Dr. Neil, from a diagnosis perspective, just because a lot of people may not quite understand what radiology is, can you just explain like some of the disease profiles and how and why
Mhm.
you would use radiology to actually either assist the doctor, and then obviously when you get into the interventional components, how you can actually have procedures as well.
Yes. Because I mean, I thought radiology just had to do with cancer, but radiology can be used for other things.
See, radiology is a part of whole medical system which plays a major role where we use X-ray, CT, MRI to diagnose a disease, but we don't treat it. Intervention radiology offers a treatment to the disease using these technologies: CT, MRI, ultrasound, uh, X-rays, and then we have a fluoroscopy. It's all minimally invasive procedures.
Mm-hmm. Very interesting. Okay. So it's much wider. And how long have you been focusing? You said it's become its own sort of subspecialty. So how
Yeah.
long have you been doing specifically interventional radiology?
I would say more than 5 years.
Mm-hmm. Okay. Very interesting. All right. And of course, Dr. Anil Shamari, one of the world's leading or largest cancer centers and Institute of Gastroenterology and Organ Transplant. Wow. So impressive.
No, definitely. And as you know, Sandy, we're always within the NH Group and HCCI, making sure that we get physicians from some of the top centers globally to be a part of the team that we have here in the
Mhm.
Cayman Islands, and especially because you know obviously now our volumes are a lot higher, but when we first started we had to make sure that we had highly skilled physicians that would have had multiple hundreds if not thousands of
Mhm.
reputation within their specialty to ensure that their skill set was good enough that no matter who came to us they would be able to deal with it. And as time has passed and now we're busier, we don't have to worry about that anymore, but we still ensure that we get the cream of the crop when they come to
Mhm.
Health City. And just like you, Sandy, and Dr. Neil, at first when I used to hear radiology, I used to think oncology, and I didn't realize that obviously from a diagnostics perspective, that's where you'd have radiologists. And then on top of that was the first time I heard about interventional radiology, which
Mhm.
is the minimally invasively subspecialty that you're using to treat as well.
Mhm.
Um, Dr. Neil, if somebody, can you just explain from first a radiology perspective, all of the different diagnostic tools and in layman's terms, how it helps physicians that then need to treat those specific ailments? And then if you could go into how interventional radiology takes that to the next level, and that's what's unique about your skill set as well, which isn't it's not like we have many interventional radiologists even within the Caribbean. So it's very unique and people come to us specifically for Dr. Neil's skill set as well.
Mhm. Fantastic. Dr. Anil?
Yeah, let me explain how the intervention works. Intervention basically we use certain high-end techniques like an X-ray, ultrasound, CT, MRI to guide the placement of the tools.
Mhm.
Our tools includes a small catheter, small needle, balloon, stents. Anywhere in the brain, from the head to toe, we can insert all these tools anywhere in the body. And most of the procedures are done under local anesthesia, and thus reducing the risk for general anesthesia or open surgery. And patient typically go home on the same day or within 24 hours. And there are a lot of clinical applications for intervention radiology. Let me go through one by one. The first is most common is peripheral arterial disease, and most common here in this part of the world where there are a lot of fat, calcium deposits in the arteries. So this restricts the blood supply to the both the limbs. So what we do is with using a small nick from the groin, it is less than a peanut size, a small nick, small incision. We'll put a needle inside the artery. We use a wire, catheter, go into the artery, open a balloon, try to open up the block. If block doesn't open fully, then we'll put in a stent. And we are doing just to improve the blood supply to the limb, to save the limb. And certain conditions like a varicose veins, where the patients will be having a lot of skin discoloration, skin changes, a lot of dilated veins around their legs, sometimes venous ulcer. We do offer a endovascular laser ablation technique where we put a small thin wire from the ankle from the ankle up to the groin under a local anesthesia, sometimes general anesthesia, depends on the patient condition. And we'll try to burn the entire dilated veins. And sometimes we do offer a percutaneous sclerotherapy for all small dilated veins, like a spider neve kind of. And in gynecological conditions like large uterine fibroids with a lot of bleeding, vaginal bleeding, or post-delivery, postpartum hemorrhage. Sometimes they have a lot of vascular malformation in the uterus. We do offer like an embolization, uterine fibroid embolization, where same thing, a small nick in the from the groin, will use a wire, go inside the uterus, just periphery of the uterus, and we'll try to block the whatever the culprit artery which is supplying the fibroid, selectively block it. And this avoids need for an hysterectomy as well. We can save the uterus. And we can use interventional like oncology. We can do biopsies just to know what type of cancer it is, whether it's a benign or a malignancy, using a small incision. And we do offer like chemoembolization, where whenever we give a systemic chemotherapy from the hand, it will go to entire body. There will be a systemic toxicity. And what we offer in interventional radiology is from the small nick in the groin or from the hand, from the wrist, we'll go inside your liver, wherever the tumor it is. If it is a liver, we'll go inside selectively into the tumor. If it's in the kidney, we can go selectively into the kidneys, and we can inject a chemotherapeutic drug over there. So it will be a localized treatment. And the lot of breast conditions I have seen in this part of the world, it might be benign, it might be malignant. We offer a variety of interventional service to breast lesions, like biopsies. It will be done under daycare with a small nick. The procedure takes less than half an hour, and patient go home in less than 2 hours. We do biopsies where small bits of pieces will be taken, and it will be sent for histopathological examinations. We offer clipping, where we'll put a small coil inside the lesion, and we do offer a wire localization, where we'll put a small wire within the lesion so that the surgeons can do a lumpectomy surgeries. And we have an advanced technology called VAB. It's called vacuum assisted breast biopsy, where we'll put in a needle inside the lesion of the breast, and the machine will suck the entire tumor. It's done in benign conditions, where it will suck the entire tumor. You don't have to, no surgery, no stitch, and no sutures. And interventional also helps in like patient coming with a hemoptysis or bloody vomiting, blood in stools, melena. So we do offer like bronchial artery embolization or a mesenteric artery, a targeted artery, super selective targeted artery embolization. Will go in and try to block the artery so that the bleeding will stop. And intervention also extends to the dialysis patients, where we do AV mapping for the fistula creations. And sometimes what happens over a period of time after repeated dialysis, maybe like a couple of months, maybe after years, your veins gets blocked, your artery gets blocked, the fistula will fail. So rather than going for another fistula, another surgery, or a permacath or something like that, what we offer is we do a thrombolysis, where we'll go inside the fistula from the hand with a small nick. Through the small wire, we'll go inside across the fistula. We'll put a thrombolytic agents. We try to dissolve the thrombus, and then we'll use a balloon to open up the whatever the stenosis it is.
Mm-hmm. So, I mean, it's almost like every part of the body almost is a candidate for interventional radiology. Wow.
Yeah.
This is quite fascinating.
Even the new IR is emerging in emergency services as well. We do offer services in the trauma and bleeding patients. Somebody who comes with a road traffic accidents, with a hematoma, with lacerations in the liver, in the spleen, they'll end up in internal hemorrhage or small aneurysms. We the same incision. We most of the procedures are done from the groin, from the hat, around the wrist, or from the neck. Small neck with a small wire will go in and selectively block that artery. We can save the liver, we can save the kidney, and many solid organs. And sometimes postpartum bleeding might happen in a post-delivery patients, where we offer an embolization in the emergency case as well. Sometimes we do have patients like a brain stroke, where they'll come with a block in the arteries in the brain. We'll go in, we can aspirate the block using, we have an high-end machines, aspiration machines. We'll put in a catheter, we'll aspirate entire thrombus, we'll try to open it, or we can use the thrombolytic agents as well. Certain vascular emergencies in this part of the world, the most common is DVT, or deep vein thrombosis, where the patients end up in having clots in their veins, in the legs are swollen, the edematous, and then sometimes the thrombosis has already reached the heart and the pulmonary veins. It's a very grave critical conditions. Again, same with a small nick, small incision, using a wire. We'll go in, we'll try to suck all the thrombus from the leg, from the entire IVC. We also go across the heart, going into pulmonary artery, whatever the major massive embolic thrombus, whatever the block is, the blood clots within the pulmonary veins, we can just aspirate using a high-end aspiration machine catheters, and then we can always do plasty as well for the chronic conditions.
Let me ask you about DMV, because that is interesting. I hadn't really thought about the fact that you could treat it, but of course, this is a condition oftentimes brought on by people who travel. They tell you that you have a very high risk of it if you're traveling long distances, especially. And I guess the elevation will cause, is it really a blood clot throughout the body?
Yes, it's not toward the body. Majorly, it happens in the legs. Yeah. If you keep your leg immobilized for a long time, the more blood will be there in your legs.
Right. And this is one of the reasons, if you're traveling long distances, folks, they recommend that you, Shamari will know this from our little trips across to South Africa and Greece. Take your what do you call them? Compression socks or stockings, and you wear those on the plane. And you also are encouraged to get up and move around. It's easy to think, oh, I'm going to sleep the entire 16 hours on the flight. That's really not recommended. It's recommended that you get up, you move around. Even if you're sitting, just keep moving your feet, circulating your ankles, doing leg lifts and that sort of thing, because you want the blood to continue.
Yeah.
But this is something that you can actually treat with IR as well.
Yeah, definitely, yes. This will be a life-saving as well. And many a times what happens, patients will be treated with the medical management, with the blood thinners and all those things. And half of the patients, they'll end up in post-thrombotic syndromes. Like they'll have symptoms, they'll again complain with chronic pain, they'll keep having recurrent leg edema, there'll be residual thrombus as well. So in the acute and subacute conditions, what we can do is we can just put a wire catheter and then suck as much as the blood clot load in these veins. And we do offer IVC filter placement, where just imagine a situation where you have a clot in your leg, but it has not yet reached the heart or the lungs, and somebody who is like there is a contraindication, medical contraindication for the medical management of DVT, like a blood thinners. So we put an IVC filter within the IVC. IVC is just like a connection between whatever the blood from the leg, it flows across the IVC, then it reaches the heart, then it reaches the lung. So putting a filter in IVC, what happens is the clot will not move from the leg into the heart. It stays within the leg, within the IVC.
Okay. Yes. And these clots, when you talk about this, it's almost like a screen that you put in that basically pulls the clotted blood away or out. Is that kind of how it works?
Yes. Like we use thromboaspiration devices. It is just like a vacuum device we use in our house. These are like a small vacuum devices where we'll put a small catheter across the thrombus, across the blood clot, and externally it will be connected to a high-end machine. And there will be certain settings, depends on the vendor. We'll just fix a setting, and then we'll try to pull most of the clots. We'll suck it. It will come externally. It will be collected in a small jar.
Yes. Fascinating. Okay. All right, folks. So the benefits of this interventional radiology are numerous. Minimally invasive. So you know that means a quicker recovery time, fewer complications, reduced risk of infections, no large incisions, less pain, which is very, very important, shorter hospital stays. So he was mentioning, Dr. Anil was mentioning earlier, that a lot of times it's almost like a same-day procedure. You're able to recover a lot faster. And of course, none of us like to be down and out. So a faster recovery is very, very useful. Suitable for high-risk patients who cannot undergo general surgery. So there are some people, because of perhaps other health conditions, age, and so on, they're at high risk if they have to be put under for long periods of time. And so this IR, because of the minimally invasive nature of it, is also extremely helpful to those individuals, and cost effective. So, everybody's watching the pocketbook and watching the cost. Even your copay, if insurance will cover it, you still have to cover that copay. And so it's going to be a cost effective solution as well compared to regular surgery. So quite a few benefits. And let's talk now about interventional radiology in cancer care, because you see, when we started out this morning, I must admit, when I heard radiology, my mind was limited to just cancer care. But look at the slew of areas that Dr. Anil has told us about. So everything from cancer care, but also vascular conditions, liver and kidney issues, uterine fibroids, I had no clue, abscesses and fluid collections, even dialysis patients can benefit from this. Breast interventions, so everything from, tumor ablations, biopsies, and so forth, even varicose veins. Wow, that's pretty cool. And tumors as well in all parts of the bodies, from the liver, kidneys, pancreas, lung, and soft tissue tumors. So a wide scope of use for interventional radiology. And now we can have a look at cancer, Dr. Anil.
Yes, interventional radiology plays a major role in oncology. Initially, let's start with a diagnosis. You don't know what type of cancer you have. So intervention offers biopsies. It will be done under local. Most of the cases, it will be done using an ultrasound, CT, or an MRI. Putting a small needle inside will take a small bits of tissues and collect it in a formalin jar, and this will go for the histopathological examination. This will tell you what type of cancer you have. And in each cancer has certain grades, certain different types. According to that, the management the plan changes. And sometimes if it turns out to be benign, like last month I had a patient where there was a small 2 centimeter lesion, 2 to 3 centimeter lesion in the kidney. We suspected malignancy, and I mean it was referred by outside hospital where they offered nephrectomy, removal of the entire kidney, and they did not do the biopsy as well. So, and other hospital tried twice, they could not do a biopsy, and they offered just a straight away nephrectomy. But in our health city, I did a biopsy. Then that turned out to be a benign lesion, and now we offered her a follow-up rather than removing her entire kidney. So we saved her kidney just by doing the small biopsy. So to diagnose, we can do a biopsy. Sorry.
Okay. All right. Wow.
Interventional radiology offers a treatment like we do cryo or thermal ablation. Ablation is basically we use like a cold ablation or a thermal ablation. Just imagine you have a small lesion in your liver, maybe 2-3 centimeter, and patient is not fit for surgery. Or why do you want to get a hepatectomy, like a removal of your liver, a part of a liver resection? Under general anesthesia, we'll put a needle inside your liver and through put a needle within the tumor and then just burn it. The entire process will take less than 1 hour. You don't have to go for surgery. And we do offer like chemoembolization, where we'll selectively go into the tumor, irrespective of whether it's a liver, whether it's any organ. We'll inject a chemotherapeutic agent so that there will be a good response to the treatment. There will be a palliative care. IR offers a palliative care as well, like after surgery, after radiation, they'll be end up in having a lot of regional pain. So we do a regional anesthesia as well. Sometimes cancer patient need a supportive care, maybe like they have to undergo chemotherapy. We put a chemotherapy chemo ports as well. And sometimes they need like a feeding tubes, maybe a nasogastric tube or a nasojejunal tube, or sometimes a PEG tube, directly a gastrostomy tube for the feeding.
Fantastic. Again, the technology that is available now to cancer patients in IR obviously is one of them. I think is amazing, and we never know who might have to have this journey. And knowing that you don't have to, do it without the adequate medical professionals here in Cayman. You've got them right here at Health City Cayman Islands. They can assist with your cancer treatments and really just improve your outcomes, improve your comfort, your access to care. It's just absolutely amazing that you don't have to go overseas for these types of treatments now. So increasingly used in oncology for precise tumor targeting. And Shamari, I remember when I went to the radiology center there, the Gene Thompson Radiology Center, and had a tour, I was really taken aback, by the facility itself. And your staff went through and showed me all the different elements of the facility. Tell us a little bit about what the patient uptake has been at the center there.
Oh no, definitely. So it was and radiology and radiotherapy with radiation. I want to make sure that we understand the distinct difference, right? So radiology, you have guided therapies, as well as you're actually diagnosing, and it's imagery that you're using and the such in order to treat. Whereas with the radiation center, that's another level and separate. So I think at times people mix the two up, and obviously interventional radiology is also can be used from an oncology perspective, but just want to make sure that we make that distinction. So Dr. Neil, I don't want to do an injustice to it. So can you just describe the difference between what a radiotherapy center actually does, and then from a radiology perspective, from the image guided procedures, what's the difference between the two? And then I'll explain the take up in the Gene Thompson Radiotherapy Center.
See, initially radiotherapy was a part of radiology, and now it has become a separate branch.
Okay.
And radiology and interventional radiology is a part of it's a separate branch, and radiotherapy is a separate, where interventional radiology is a super or subspecialty where we pursue after doing our masters in the radiology.
That's why I was confusing them, Shamari. I'm so glad. Listen, you really are going to have to be Dr. Shamari soon because you see where my confusion came from. Yeah, so I was thinking of radiology, but really now it's two completely separate fields. Interventional radiology is a specialty completely unto itself.
Yeah,
I got it.
Interventional radiology is a minimal invasive procedures. Like we do all minimally invasive techniques.
Ah, okay. All right.
Radiotherapy is a separate, different branch. It's a different specialty.
Mm-hmm.
After your MBBS, you have to do a separate masters in radiotherapy, and
Mm-hmm.
it's nothing to do with the radiology.
Wow. Okay, I got it. Now it clicked because in my brain I was still like, oh, these are but I see where the names are so incredibly close, of course, because sort of connected in a way. So I'm glad that you clarified that for me, Dr. Shamari.
No.
Because I'm sure if I was confused in my head, there were probably other people who were equally confused as well. So I appreciate that explanation. Ms. Rosemary says this was very informative. Yes.
Yeah, and also Sandy, but just to mention the Gene Thompson Radiotherapy Center. Obviously, we understood that there was a gap, not only in the Cayman Islands but also in the wider Caribbean. Sometimes they have equipment that may be a little bit outdated, or at times they may have the equipment but not the full complement of the team that's there to carry out some levels of the type of radiotherapy and treatments that are needed. So we offer a wide array, we can treat a wide array of different oncology disease profiles within Health City now, that we have it. And when we first started, we were actually shocked how oversubscribed it was, just based on the fact that we knew the numbers, we knew what it should have been. But what we found is that there were areas where persons would have been approved from 6 months prior to go overseas. And whether it was the fact that the family life with the kids and or to get the time off, believe it or not, off work to go for at times what can be weeks at a time, anywhere between 4 and 6 weeks. There were persons who actually put it off even though insurance had approved. So what we couldn't foresee, obviously all the new incidents, we had the data on that at some level, but what we couldn't foresee is people who had put off getting their treatment just based on the hassle factor or the job situation. And that's why even when we started, we realized that we needed to open earlier in the morning because people are coming in for their fractions where it may be 15 minutes, 30 minutes out of your day that you need to do based on your plan every day, etc. But they could come in the morning and get it done. And then if they wanted to go to work, or if they wanted to drop off kids. So we realized that we needed to, start earlier in order to help our patients as well. But it's actually going well. And we're very happy that we're able to actually treat, obviously, the local population, but we also have international patients who otherwise wouldn't have been able to afford from their insurance perspective, just because a lot of the Eastern Caribbean plans have caps that are less than what we would have in Cayman. So if you have a cap that caps you at 500,000 life, your lifelong cap, or $1 million, for instance, when you're talking about radiotherapy in the States, that's not going to carry you very far in most instances. So we're seeing Caribbean patients as well as Central American patients, and obviously our local patients we're able to treat in the Gene Thompson Radiotherapy Center as well. And just based on how it is constructed, instead of making it self-contained or attached to the building, we built it separately so we could get it up a year in advance, and we would have been able to make a difference in dozens, if not over 100 individuals that would have had access a year earlier than when the rest of the facility was built. But yes, we're excited about that component as well. And obviously, we'll bring in Dr. Vikas to speak specifically about the Radiotherapy Center. But having Dr. Anil here from a radiology perspective and an interventional radiology perspective helps us to more or less fill out the team that we have, that we're able to deal with all the various aspects, as well as from a minimally invasive perspective as well.
Fantastic. All right, folks. So Health City, Cayman Islands, here every single Tuesday, giving us very, very informative sessions on what it is that they offer at their 2 locations now, all the different services. We also have, features of, last week we had the educational component, what they offer to Caymanians and local students in particular, career advancement. And so they're just keeping us in the forefront of all things related to healthcare. I absolutely love these segments, and we learn so much information. I must say that there's never a segment that I don't learn something. And so that's what I absolutely love about these. So thank you so much, Shamari. Dr. Anil, of course, a part of the team there that complements the wide amount of services that they offer. So let's talk about IR in the Caribbean context now, Dr. Anil.
According to my last couple of months of observation, I have seen many Caribbean patients face delays in accessing the specialty surgery for diagnostic or interventional radiology procedures, maybe related to equipments as well. IR offers a timely and high quality alternatives, even for patients who may consider like high risk or unsuitable for traditional interventions. And the interventional radiology has become a standard care of many institutions, offering a faster and a less painful procedures compared to our traditional surgeries, as well as a potential cost saving for the healthcare system as well. So as a center for medical tourism, Health City uses interventional radiology to expand minimally invasive care to both local and international patients. We have a very high-end cath lab setup in both our hospitals with a very well-trained technicians, and we have a very huge interventional radiology team as well.
Fantastic. All right. So not just patients here in the Cayman Islands, we know that we have regional listeners to this program as well. And you now can also benefit from the services at Health City Cayman Islands. So reach out. 345-640-4040 is the telephone number. And, there's no need for you to suffer with all the conditions and diseases and, complications that come with it. You've got interventional radiology available to you right here in the Cayman Islands, top-notch medical facility. Shamari?
No, definitely. And our Caribbean partners have taken advantage of all of the different areas. And for many times, it's also listening and hearing, you're solving this issue, but here is another issue that we'll see. So we have a lot of relationships with physicians in different countries, with governments, with medical directors. And, after the first few years, we always get the questions, can you bring Health City here to us and just add X Caribbean country? But most ask how we're able to help. And obviously we do where we can, from clinics and otherwise, and expertise and supply chain and to try and help where we can. But outside of that, obviously we'll also take the tertiary level patients that they have that they can't specifically deal with. And we'll be able to treat them at Health City. So this is just another area in a long list where we've been able to help surrounding countries as well as Latin America. And depending on the actual specialty, we get patients from the cruise lines, crew members, as well as out of the US and from Canada as well. So not only are we here, obviously, for the Cayman Islands population, both Caymanians and local residents. We're also here for the wider Caribbean, Latin America, US, and Canada, depending on what the need is.
Wow. All right, very good. All right, well, thank you guys so much. Anything else that we wanted to touch on this morning, Shamari? I know we got some prizes coming up in a couple weeks. The end of the month, anniversary celebration, 11
Definitely.
years.
So yeah, 11 years, end of the month. That last Tuesday, we'll be having our anniversary giveaways. So everybody needs to listen intently, so they'll be able to win some of those giveaways. But thank you, Dr. Anil, for taking time out to come and explain it to the CMR family. And Sandy, thank you as always, being here every Tuesday for us. Look forward to
Absolutely.
seeing you next Tuesday.
Fantastic.
It's my
Dr.
pleasure.
Adam,
Thank you.
Thank you so much. All right, Shamari, we'll see you next week.
All right.
All right, thanks very much. So again, another fantastic segment with Health City Cayman Islands. And yeah, I'll tell you what, they've got a whole complement of services there. I have to utilize Dr. Naranjan and the orthopedic team at the moment. You know, listen, having a little bit of knee pain, it's impacting my ability to walk. I'm hobbling along a little bit, but it's not, I mean, it's serious for me because I'm in pain. But again, you know, just doing some physiotherapy and, you know, something that it hadn't really occurred to me is I know you guys know I have my TENS machine, which I use for other things. And I hadn't thought to use my TENS machine on my knee. So I spoke to a physiotherapist and they said, yes, of course you can use it on your knee. Just don't put it on the bony area of the knee, put it more on the sides. And the sides is where I'm having the pain. So now that I know that, you guys know I travel with, when I say travel, I mean always in my car, my handbag, with my TENS machine pretty much 24/7 because, you know, chronic pain is no fun, folks. So here's my handy little TENS machine this morning. I actually have 3 of them, believe it or not. One I haven't even taken out yet, but yes, I have one at the bedside. So if I have a little pain flare up at night, I stick that on my feet and I'm you know, falling back to sleep in tutus because lack of sleep with the pain is horrible. So now that I know, I'm going to be putting that right on my knee, honey child. And yes, so, you know, we do what we got to do to live as a comfortable life, pain-free as possible. It's not always easy, especially when you start to get up in age a little bit. And it's really, really important, folks, that we continue to move. That's the key thing, right? So pain can immobilize you, but it's kind of a double-edged sword because when you're not moving, you're immobilized, then the pain actually gets worse. I can tell you that when I sit down and I get up, that's when I feel the knee pain the most. So keeping it moving, even if I'm sitting, I'm like trying to stretch it out and stuff like that, is helpful. So praise the Lord for TENS machines. I'm going to put it on my knee right now. So that and icing it is the recommended treatment. And then just taking some Advil. Dr. Naranjan, when I messaged him yesterday, he said, yes, take some Advil and you should start to feel better soon. I'm not even sure I have Advil. I think I have other things, but I'm going to get myself some Advil and there you go. Everything's going to be A-okay. So that was a very, very interesting discussion this morning. And I must tell you, yes, I was a little bit confused, but now I got it. Now I can be an A student again. Thank you so much to Dr. Adil and thank you so much to Shamari. So I see a question here from Sus Kumar. Sus Kumar is asking questions related to labor law. And I think, Sus, you must have reached out to us before because as I recall, let me see here. As I recall, we actually did inquire with this. And so I have an answer for you. You're asking about nurses and like how many hours they are working and that sort of thing. So I do have hold on one second. Let me get it for you. I do have the response because, I make sure if you guys send me a query, I certainly check into these things for you. So let me just see. Let's see here. Let me see. Okay. So the query was, again, HR related. And it was in relation to the, it was in relation to, yes, so somebody sent this one actually by email, what they're working. So this is the formal response. And of course, to my knowledge, there have never been any accusations of any labor breaches. So Health City fully complies with all labor regulations, including those related to shift workers. Our nursing staff operates under a schedule typical of a multi-specialty full-service hospital. This structure allows us to provide comprehensive care while maintaining a balanced work-life schedule for our employees. In certain unique cases, where unforeseen circumstances arise due to the complexity of patient care, overtime may be necessary. In such instances, we ensure that our staff are appropriately compensated for their additional hours worked. So there you go. And again, I do know some of the nurses, and I've never heard any complaints about treatment or anything like that. So, Sus, I have seen your comments. You keep saying, ask them about nursing and their staff. It's not an easy job. And I think that certain professions obviously are very, very much aware of the fact that they have to work shift, they have to do shift hours. It's not perhaps a 9-to-5 job. And oftentimes, perhaps a very thankless job in addition to that. I often tell people there's certain jobs that, you probably couldn't pay me enough to do. And I think nursing is probably one of them. It requires a lot of compassion. It requires sacrifices. There is a guy who does I subscribe to his channel on Facebook. He does a lot of skits around nursing. And he talks about some of the challenges oftentimes with the patients, and patient care, and them not always wanting to follow instructions and not always listening carefully. And there's just so many little things that go with the job. So it takes a special kind of person to be a nurse. And I think we should sit down and interview some nurses to kind of hear from them a little bit as well. Adele says she's listening from Antigua in the Eastern Caribbean. Good morning, Adele. So nice to see you. Thank you for joining us. And we've got lots of our usual suspects here this morning. Miss Joy. Miss Joy, are you in Texas at the moment, or are you back in Cayman? Delcy says Dr. Naranjan is good. He did laser surgery on my knee as well. So yes, fantastic. I'm trying to starve off the requirement to do any surgeries as long as I certainly can. Rosemary's asking, where do you get these machines? Now, most pharmacies should have them. I must say the very first one that I ever purchased, I actually bought from Foster's way back in the day. It was a long time ago, and I had this kind of chronic pain condition with my tailbone where it just wasn't getting any better. And I was going to physio for over a year, and they said to me, listen, we're going to recommend this now to you so that you can have a little bit of pain management control at home, because you guys know I don't like to take pills and stuff like that. And so that is how I was introduced to a TENS machine. And since then, it has been my lifeline for back pain, shoulder pain, neck pain, and there are different types of TENS machines as well on the market. But I like these simple little ones. They are just very, very effective. So like I said, I have, they have different modes and stuff, but I have 3 of these so that I always keep at least one at home and then one for the road. And when I travel, I definitely have to have one as well. So, sometimes all you can do with the pain is kind of numb it a little bit and give the body an opportunity to heal itself, because the body wants to heal itself if it can. And those are the things that you do. So Amazon has them. Miss Rosemary, if you have access to Amazon, you can see a wide variety of options there as well. But check if you're in the Cayman Islands or where you are, you can certainly check your local pharmacy. They have some that are a little bit more complex and expensive, and then some that, price-wise are actually pretty good. So yes, excellent informative session with Health City as usual, says Plain and Straight. Thank you, Plain and Straight. We have Miss Joyce Ann. Pleasant good morning to you, ma'am. Sophia says nurses normally work 12-hour shifts with 2 rest breaks. So yeah, I mean, it's a long shifts. So, you know, that's what it is. And that's the law. Miss Rosemary, you're going to get one. Fantastic. Yeah, they really do help. And it is a little bit of like, it feels like a little electrical shock. Yes, it's not always the most pleasant feeling, but I can tell you it's going to feel a lot better than the pain that you're having. I can assure you of that for sure. Okay. Fantastic. All right. So we do have, I think they're almost ready. We're waiting on the McField clan to log in. I see one person is there, and then we're going to grab the others. This person says, I love a good nurse. I wish it was that easy for me with these machines. Aw, I'm sorry to hear that. Okay. Yeah. All right. So lots of, community chatter about the usual things, by the way. And I want to say that, yesterday's discussion towards the end, I don't want to continually have that discussion. And so I've still been getting a lot of questions and feedback surrounding missing media person Andrell. And I really just want to put it to bed, to be quite frank. So what I would say is we have reached out to the RCIPS with a request this morning. And I've been saying it publicly, but I have reached out directly to them because I think that they need to say something. Now, there's something could be very, very simple in terms of there's no foul play. I mean, that says all you need to know, really. You don't need to go much further than that. In lieu of them not saying anything, I think that unfortunately, the discourse will continue that we somehow have a serial killer in the loose in the Cayman Islands, which simply isn't true. So I really hope that you guys are able to cut back on that, because it's not helpful to anyone. And even the family members who are not, the family members who are not at a stage of accepting what has transpired, all we can do is pray for them. And I think eventually, they'll get there. I mean, I had someone reach out to me yesterday, and they said, Sandy, it's not unusual, actually, and it's something that happened in their family where there was someone who died by suicide, and one parent was unable to accept it for like a year, an entire year. And there was evidence, there was messages, voice notes, everything the person had indicated, and they didn't want to listen to any of that, and they simply would not accept it. It was easier for them to accept that someone had done something to their child, like the child had been adult. When I say child, but adult child, that someone had, kidnapped them and hurt them, as opposed to them, saying that they died by suicide. And I think this comes back to the conversation that we were having last week. I think it was Wednesday and Thursday in the show, where we need to have larger conversations around mental health and wellness, and normalize the conversation. Just this weekend, I was watching something with Julie Mango, and I want to play that. And I've invited her onto the program because she is an absolutely fantastic person. And I think her life story is also so incredibly amazing. A lot of you would be very, very interested to hear her life story, but she has she has suffered with mental health issues, and she talks about that. And it is very, very interesting to hear it from her perspective as well. I want to remind you guys that this month is Mental Health Month for men, and men do have their own, month. And I think it's important to acknowledge them and the things that they go through that are different than women, and to be there as a support system for them, because the information around men and mental health care and even the suicide rates is very, very staggering, folks. They are, more likely by a significant number to die by suicide than other people. So it is very, very shocking to know that. And so, of course, we want to ensure that we're offering, whatever support we can to reduce those numbers as much as possible. All right, we will continue. Tune in on Friday's segment. We have Dr. Carlos, who's going to be joining us. So June is Men's Mental Health Awareness Month, and Dr. Carlos will be joining us on Friday. So get ready to hear more about mental health on Friday, and it's going to be a call-in segment. So if you want to call in, you can certainly do so as well. So Mr. Amelia doing a shout out to Alric Lindsay. Apparently today's Alric's birthday. So happy birthday to Sir Alric. Wow, happy birthday, Alric. Hope that you are enjoying the day. All right, almost 400 people in the live stream this morning. Let's go ahead and welcome our other guests in. Let me see now. Who do we have? Miss Evelyn, are you actually joining us? Or are you just sitting there for, there's a chat area where you can privately chat to me if you'd like. So I'm not sure. Somebody give me the thumbs up because I can't see her, but I can see other people. Is she coming on as well? Miss Janet? Yes. Okay. All right. So let's go ahead and we'll welcome Evelyn Rocket to the program. Can you hear me, Evelyn?
I am on. Yes. Can you hear me?
Yes, you're a little bit low, so just speak up a little bit for us.
Okay, not a problem.
Hear you. We have Miss Vanda Powery also joining us. Good morning, ma'am.
Good morning, Sandra.
How are you?
Not bad, thanks.
Okay.
How are you?
Yeah, very, very good. Thank you so much. And of course, we've got Miss Janet in the house. Good morning. Now you muted yourself. So there's a little button at the top there of your picture. Just unmute yourself and then we can join you back. And we have Mr. Steve McField. Let's go ahead and invite Mr. Steve McField. And good morning, sir.
Good morning, Miss Catron.
Oh, it's Hill now, honey child. Cousin Steve, it's Hill.
Yes, how are you doing?
I'm not doing too bad. How are you?
I'm okay.
Good. So good to see you.
Yep.
All right, we'll wait for Janet to rejoin. I think she just needs to reconnect the camera there. But let's go ahead and kick off the conversation in the meantime. And, it's a very, very interesting initiative. Whose idea was this, Evelyn, to have a McField family reunion?
I think it's been kicked around for some time, and I want to thank Wendy and her team of persons who actually brought it to this stage where we now have a committee that is planning this event. Over the past few decades, we've always had McField get-togethers, but it's been in clusters. We have never, ever taken on the challenge of actually bringing the entire McField clan together. And this is what we are hoping to accomplish.
Fantastic. Well, this is good. Now, do we have any idea? I think this is probably a question for Cousin Steve. How big is the McField clan?
Oh, really big. Really big. It is a really big family. Of course, there are no McFields in the Caribbean. There are no McFields in Jamaica. There are no McFields in Bermuda. There are no McFields in Barbados or Trinidad, because we didn't come through that route to Cayman. And so the McFields are mostly in Honduras, Nicaragua, Cuba, and the United States of America. That's where the McFields are concentrated. I would say that we're in the hundreds of us. There are hundreds of us. That's why that savage, the most brutal thing that ever happened in the late last century. The most the savagery of slavery and oppression to man. We survived it and did well. Most people didn't survive the that brutality. We did. So I would say we're about 500 or 600 or 700 of us scattered all over the world.
Wow. And how far back are we talking about? Does the lineage actually go?
It goes
Do we
back
have
to
an
the
idea?
to the 1800s. The last paperwork that we have about the McFields would be back in the 1830s. In the 1830s, when they after emancipation, it's not clear. It's not clear whether we had bought our freedom or not, because we're not listed in the slave registry. We're not listed in the slave registry as being slaves. So there is we're trying to find whether we had bought our freedom before the emancipation in 1835. But there's paperwork in the archives, which we have copies of the McFields being known universally from 1838, when after slavery, the Michael Trusts from the UK through Jamaica started the first public school in Borden Town, which was the capital. And they sent a man called Andrew Malcolm to teach to set up the school to teach the children, the aftermath of slavery, because during slavery people were not entitled to have an education. And Andrew Malcolm came through Jamaica to Cayman to set up the first public school in Borden Town. And when he started the school, he started teaching the black and white children together, the slave master children and the black children, and the ex-slave masters refused to allow him. They did not allow him to start the school, but to teach the black and white children together. They said that was a no-no. That was a no-no. And Malcolm decided a scheme. He built a loft in the building that was hired by the government of the day, and put a ladder up there and sent the black children up there in the loft, and started to teach them. And then the slave master, and then the ex-slave master says, well, if he was going to do that, the black children would have to pay 6 pence per week. Of course, they had just come out of slavery; they had no money, and Malcolm decided that he was not going to teach a segregated school, so he left and went back to Jamaica, and the McFields clan, with some other people, just took a petition. There are 2 petitions up that the McField signed. I think one was to Queen Victoria, and one was to the Michael Trust, saying that they should send Malcolm back because they were entitled to get their education. And of course, Malcolm never came back. What happened after that was the Presbyterian Church through the Scotland sent McTaggart and the Pantons to teach school, and the school started in Prospect, and the school started in Georgetown through the church, and the public school never materialized until later on. So we have the names of the McFields who signed the petition to that, and yes, and then in the Great Exodus between 1840 and 1850, a lot of the McFields left and went to Honduras, to the Bay Islands, because it was better land. They refused. Well, of course, that there was the aftermath. That's what after the emancipation, there was a turmoil here in Cayman between the ex-slave masters and the new slaves. The slaves refused to work for them. The slaves refused to work and serve as apprentices. Remember, after slavery, you had to serve 5 years as an apprentice, or 4 years, something like that. And the slaves refused to work as an apprentice, and then that was the reason why we got our independence before anybody else in the Caribbean. We got we got our freedom before anybody else, because of the confrontation between the whites and the blacks and Jamaica. The governor from Jamaica, Governor Sligo, sent a man called Dr. Thompson here with the regiment of the West Indian Regiment to keep the peace between the two sides. But we left. And then we have all of the records about the McFields who went off to Honduras. We have our cousin Samuel McField, who's the manager for First Caribbean. His father went off to Honduras in the early century, and he married a woman from Belize, and his son became a missionary in the Seventh-day Adventist Church, and then Sam is the grandchild of that. So we have all of the records from them. And then there's the McFields there's the McFields in Nicaragua. David McField is now retired. He was the ambassador to Jamaica from Nicaragua. Arturo McField was the ambassador to the Organization of American States, and so forth. And the McFields have thrived and succeeded. There was also the McField who was a dentist in Jamaica, and they were all the Napoleon clan. Napoleon Lee Grant McField was the brother that came to Georgetown after emancipation, and his other brothers, they all left and went to the Bay Islands and different places. So you and I and all of us are the descendants of Napoleon Lee Grant McField and Fanny McField Solomon from Bordentown. They were the two people that came to Georgetown after emancipation and staked out land and started the McField clan in Georgetown. And of course, there's also, Willis McField, Shirley McField, and all of those other McFields that are family to us.
Wow. So someone just sent me a link about some McFields in Jamaica as well. Is there a connection between the Jamaican McFields and the Cayman McFields? Because
yes, probably went from here and they spawned a family in Jamaica. Yes. Mm-hmm.
Yeah. So very, very interesting historical connections. And
so we have it. We claim that we came here with a man called Nathaniel Glover. You heard about Nathaniel Glover?
No, I haven't.
Nathaniel Glover was a man from Boston. He came here around the 17-something, 18-something, 17-something, and he was one of the richest men in Bordentown, richest merchants in Bordentown. It's claimed that he owned us when doing slavery. Now, we were tradesmen. We were builders, shipbuilders, and building homes. We were all tradesmen, the McField clan. And Nathaniel Glover got elected to the first assembly in 1831 when Cayman took its own independence from Jamaica. And after the governor in Jamaica found out that Nathaniel Glover, who was an American citizen, had got elected in Bordentown to the legislature, the colonial office said he couldn't serve in the legislature because he was an American citizen. That's where the whole thing comes from the Constitution now. And he had to give up his seat. He had to give up his seat to one of the Watlers, I think Watlers from Bordentown. He had to give up his seat to him. And Nathaniel Glover lived here. And then I think he went back to Boston and his wife. There's a place in Bordentown in Lookout called Katie Glover. Roy Borden is the expert on that. That was owned by Nathaniel's wife. It is said that we worked for him during the time that he was in Cayman, and Nathaniel Glover, and then we abandoned our home in Bordentown. Napoleon Lee Grant McField and Fanny Solomon And of course, Fanny Solomon had one son before she got married to Napoleon, and that was Miss Annie Connor's father, Uncle Ernest Connor. We didn't know that until later on in life. We used to see him come to our grandmother's house, but we didn't know that he was my grandfather's half brother until later on in life. And then they came in Georgetown and they started McField Square, and they staked out a lot of land, a lot of property, and so forth. At one time, we owned a lot of land on the 7 Mile Beach area, down a place called Michelle's, where the first turtle crawl was, and we used to own all the property around the Cayman Bay area too, around Cayman Bay area. We owned a lot of. We were one of the richest black families in Cayman, and property wise, the Andersons, the McFields, and the Seymours. Yeah, of course. I have pictures of my grandfather, one of the only black men in the yacht club at the time, because my grandfather my grandfather sail his canoes too, and he was a shipbuilder. My he was an oddsman. You know what an oddsman is?
No, sir.
It's some instrument shaped like a hole. It's the thing that shapes the ship ribs.
Okay.
The thing that all of the structure of the ship is built on. That's what his trade was. He was the best oddsman in Cayman, and he was one of the strongest men in the Cayman Islands at the time. And he would go into the woods and he would stake out the mahogany hardwood that was the shape he wanted, and they would load him up, and he would walk to the road where they had a old truck or cart or something to bring it to town. He also and one of the things, Sandra, that's not in the archives, that should have been in the archives, is the voyage in 1838, in 1938, between he and Captain Thomas Diaz, some rock hole. He and with 7 Caymanians that sailed the Earl of Mountbatten's yacht from Jamaica to England, the Lost Horizon. The ship came to it was one of the most advanced yachts in the world at the time. At the time, in 1838, and they came to play polo, to the polo tournament in Jamaica, with the Earl of Mountbatten, Prince Philip's uncle, the Queen's uncle too, and his lieutenant Phillips. They all came down and to play polo, and then the threat of the war started, and they had to get back to England quickly. So they took the big passenger ship back and left the Lost Horizon berthed in Jamaica. But then they decided that they wanted the Lost Horizon back in England. And Jamaica, what they call the Jamaica Board of Trade, which is now we call the Jamaica Port Authority at the time, they asked them if they could recommend a crew. And they said, well, the only people that they could recommend that was reliable was the Caymanian crew. And they were a young, gifted navigator captain called Captain Diaz, Thomas Diaz, some rock hole. Captain Tom, my grandfather, who was his boatswain's mate, and a guy called Lee Godfrey, and the record show just some of the names, G.E. Banks and so forth. It was 7 Caymanians on the ship, and they went on the Semboko to Jamaica. They joined the ship. The ship had the only white person on the ship was 2 white people on the ship. The lieutenant I told Phillips, and the ship's engineer, who was the engineer, and they took the ship into Bermuda, where they were outfitted with their uniforms, their naval uniforms, and so forth. and they were there for about a couple of weeks, and then they took off and went up to England. They were taking the ships back to England. They ran into a lot of storms in the North Sea, and there's a record that Lemuel McField, who was the boatswain's mate, was saved the ship, and he was like 10 or 12 hours on the wheel because there was rip tides coming from all directions, and rip tides come from all directions in the North Sea, and just out in the Bay of Biscay, and the south of London, in the south of England, the south of England, 2 o'clock in the morning, the Lost Horizon caught a fire.
Wow.
The Lost Horizon caught a fire. SOS went out, and this is all in the New York papers and in the Baltimore papers and in the Gleaner, and a Scandinavian passenger ship, rescued them and took them into the south of London in the Portsmouth, and Lord Mountbatten came down on train and took them all up to London, and they stayed at a place called the Queen's Rest. It was a guest house for the Queen's Rest, and Captain Tom and his crew were invited to the Buckingham Palace to meet the king. They had tea, and later on, I have all of the records where Captain Tom and Lemuel McField came back to New York on the passenger ship, first class, and then they came back to Jamaica on the same boat and came home. And not a mention of that is made in the history of Cayman. I had to go and research that myself. That's all recorded in the Baltimore Times, the SOS that went out. It's all in the Jamaica archives. It's all in the New York papers too. I wrote a piece about it. I wrote a story about it. I had to print it. It's called the Forgotten Men of the Forgotten Mariners of the Cayman, and that was a great feat. And Captain Tom, for what he did for the royal family, was awarded a worldwide license to be a captain in any ship that float. Captain Tom Diaz, and in 1962, when Prince Philip came, they were invited to Galleon Beach for dinner with Prince Philip, and I have all the photographs of that too, with Captain Tom with Prince Philip at the Galleon Beach Hotel, with Mr. Ernest Panton, and so forth, and so we made our contributions. So from the beginning, we were always interested in education, in educating ourselves. That came down through the family. Teacher McField, who was the first educator here, one of the first educators here, and yourself and myself and the rest of the family. So we are a formidable family who never fell apart. We had our ups and downs, but we never fell apart. Slavery never affected us like it affected a lot of other people who are still affected by it now. And we have this penchant to survive and to grow. And it's my grandfather always used to tell me, that we are not just sophisticated colored people. We are hard working people, and the pride and the stuff that he walked, and he was known as in the white circle as Uncle Lemmy, and he was known as, and not only that, but some of the contractors on the day got the praise and the medals from the British OBE and the HBE and this and that. He never got anything. He and a guy called Mr. Felix Thompson. But they built the town hall, they built the library, they built the post office, the church. They built most of the homes. They built the trawlers, the trawlers, the minesweepers, that the British government built here in South Church Street. They built them. They built the gold field, the gold medal, Simboko, the legislator. He did most work on all of those ships with Rail Borden, the late Captain Rail Borden, and also the Arches. He worked with those people on the big schooners and the big and the big jobs. And of course, we had one of the finest homes on Maryland. They're now called Mary Street. We had a real big home. I grew up in a big house. Your mother, we all grew up in a big house with a veranda all around and so forth. It was a grand house and it's now destroyed. People came and took all of the veranda off and made it into a shop. I think it's now a barber shop as the entrance to McField's Lane. And that is where the old family house used to be. Napoleon's house, the old family homestead, was inherited by our grandfather, Lemuel, and our aunt. We had an aunt that lived there, Aunt Malvina. She was a midwife, and for many years the house was a clinic for Dr. Overton, where they birthed children from North Side, East End, all came down to Georgetown to that house to get birthed, and so forth. And some of the remnants of the old house is still there. Doreen's boy, he's now building apartments on that site of the old family house, the old Watland Daub house, which was the old family homestead, original McField Square.
Right. Wow. So undoubtedly a formidable family here in the Cayman Islands. So let's turn back to Evelyn now and Miss Vanda. I think Jan dropped out, but we'll continue the conversation. So what's really the objective behind holding a family reunion? Are you hoping to find people who are part of the McField clan that you didn't know existed?
The most important thing that we want to establish is, one, the connection that everyone knows the lineage that they came from, and also for people to learn a lot about their family history, because we have the younger generation who are not knowledgeable about who the McFields truly are. So that will be something that we'll be stressing on, and we're looking at December the 19th, 20th, and 21st as our celebrations and get-togethers, and basically seeing who is who and fellowshipping together and having a really great time, that we can ensure that our history never gets forgotten, that is passed down from generation to generation. We are very privileged to have Steve, who is the oldest grandchild of Lemuel McField, alive. And we are ecstatic at the amount of knowledge that he has and documentation. So we want to share this. Now, how can people reach out? And I'm going to leave this now to Vanda for her to say how people can reach us and for us to build a database that we can all keep in touch going forward, because we have people all over the world now, but the world is very small, and we'll leave it now to the younger ones to talk about the social media and technology to reach out.
Okay.
Vanda?
Yes. I think you, there we go.
Sorry, hello everybody. What we've been working on in terms of data collection, because our family is so large and, throughout just globally, really, we're working on creating a form which will have QR codes attached to them, thereby, enabling persons to, enter their information as well as their parents and grandparents who, in essence, then would connect directly to Lemuel and Sarah's children, as well as his siblings also who are here on island. We have an email address set up, which is McField Family Reunion at gmail.com. So we're asking for persons to send pictures, send information to that email address, which will, enable us to continue to streamline putting information together, and just really kind of, culminating, whatever sort of data records and so forth that can very well be added to the vast amount of knowledge and so forth that Mr. Steve have also shared, and that is also on record. We're really looking forward to having a grand time with as many of us as possible. We've planned it in December, giving persons enough time, to plan and include it into their schedules. Additionally, for family who live overseas who are interested in coming, to save the date for that weekend also. So we're definitely looking forward to persons, like I said, sending in information, pictures, whatever they might have, to that email address. And once we get the QR code set up for the data collection form, then that also will come out in short order.
All right. Do you have a website or email address or anything like that people can reach out to you? Might be people listening from all over the world.
We do not have a website set up. Right now, it's just the email address. We considered doing a website, but we know that would take more than our technology experience. If there are persons in the family who have this experience, who have the opportunity, please do contact you or contact us via the email address, and we'd be more than happy, to work with you so that we can actually have something more global, online, so that persons, it makes it easier for everyone to connect.
Fantastic.
Steve, would
we
you
hope
be
to have a video at the reunion. We hope to make a video of the McField
Yes.
from the inception until today, because we have a lot of talent in the McField family. You have Dr. Frank McField. We have my son, who's a surgeon, who's a bariatric surgeon. A lot of people don't know anything about Darren, who's a bariatric surgeon in North Dakota, and doing remote surgery from one hospital to the other and so forth. Brilliant people. We have a lot of brilliant McFields, and we have McFields in football. We have McFields in Tampa. We have McFields all over, and we're just trying to our history is our roots, and we're trying to plant our roots deeper, so that we were not forgotten, and that that the pride that our forefathers had been bringing us here, and helping us to get this far, that we can pass this on to the other generation that's coming, because it's not going to be easy for them.
All right. Well, fantastic. We do have a few comments, and then we're going to wrap up this segment here. George Bodden says there's a lot of us in Cuba, Isle of Pines. We have Lisa Prendergast saying the late Miss Onisha McField and my late mom Joyce held one of the first marches demanding children have a school in Georgetown after a child was knocked down many years ago. People worked together. Lemon Drop, remembering Mr. Lemuel McField, formerly known as Farmers. Thank you so much. And Emily Wilkes, Miss Magdalene is remembering. Lisa also says sincere thanks to Tita, Nini, Miss Baba, Miss Mavis, who always cooked and shared love, kindness, and raised villages of children. Thank you all. Island Pearl says, according to Google, 1/5 of Caymanians are of European, mainly British ancestry. Another 1/5 are Blacks and the descendants of African slaves, and 2/5 are of mixed African and European. So some very, very interesting conversation. So Lemon Drop says, that's my grandfather. Well, Lemon Drop, that means that you're McField. So you will definitely want to come out to the family reunion. I tell you, we're all family and we're all cousins. And of course, I think most people know that I myself is related to the McFields on my mother's side. So yes, some very, very interesting history. We'll have them back on the show as we get a little bit closer to the reunion time, and we'll have some more details, I'm sure, at that particular time. But thank you guys so much. Justice says history is good to listen to, but most of us don't read history books. Always love to listen. So at least it's good to listen and to hear. So George Fullerton, also enjoying the segment, says very, very interesting. Well, thank you to Mr. Steve McField, Evelyn Rocket, Vanda Powery, and unfortunately, we had Ms. Janet who dropped out on feed there, but we appreciate all of them coming on the program and sharing a little bit about the McField clan. And it's good to always know more about your history and your family history. So Lisa says, good morning, McField family. Thanks for sharing this family history, but thanks to all the McFields who cared for one another in Central Georgetown, raising their friends' children, sharing food recipes, and so on. Magdalene encouraging Dr. McField to write a book. Maybe government could give him a grant to get this initiative going, she says. I still want to sit down and interview him, of course, in one of my K-Man Voices segments, because he is like a walking history encyclopedia. So much information in that brain of his. Dr. McField, can we pressure you and ask you how old you are now? Because
I'm 90.
you don't look your age, but
I'm 90.
Wow.
And
So
I'm 90. And Sandra, one of the reasons why I have not written, I would say, you know, the usual people say they vex. I'm not vexed. I am upset that my colleague and contemporary Roy Borden has written so many books, and not one of them are in are in the curriculum in any school, university, or the high school for reading, and that shows you that that we had never we were never a country that was interested in education. How they mocked us when we came back with our education in the 1980s, they call us educated fools and communists and so forth. They did the same thing to Teacher McField. When he went to university, they took his first year books, economic books, when he got to the airport. A lot of those things they put on the ban list, book ban list, and how they treated us because we were always interested in education and information. And that's one of the reasons why I didn't want to put myself through that rigor, because why is it that Roy Barton's books are not part of the of what we should be learning about ourselves? And I didn't want to be in that category where they just ignore you and find out and you know yourself as a why you're in broadcasting. You're supposed to be a lawyer. Why you're in broadcasting? You know what happened to me when I came back with my education, what they did, and how they try to push me out and alienate me and ignore me and turn their backs on me in court and so forth and so forth. And that's the reason why I didn't want to write any books about
yes.
my sojourn, my journey, and the McField journey.
Well, I mean, I always have a saying, you're right where you're supposed to be. So I suppose I'm making more of an impact sitting in this seat than a lawyer in a courtroom on a lot of days. But I tell you what, I think capturing the oral history, even in recordings, is very, very important because, as you rightfully said, unfortunately, a lot of people don't read, but they love listening to you. And I can tell you because people are messaging me saying they can sit down and listen to you all day long. So, you know, maybe that's the, we meet the people where they are, so to speak. So Gabby says, what if someone is unsure if they're related to the McFields? Well, I think that's one of the great things about modern technology, and also even coming to the reunion, you'd be sure. So Lemon Drop says here, yes, my grandmother, Miss Esenta, used to take me to look for your dad a lot. So, you know, there are connections there, folks. I've told you about a lot of these online genealogy tests that you can do. I did 23andMe. That company has now been sold, so I've taken my data off of that website. But I've also done Ancestry. And you can find out a lot of connections by looking at who shows up on your list of family. But oral history is very, very important, Gabby. So sometimes you need to sit down and talk to our esteemed elders like Mr. Steve McField. He'll be able to tell you because, you know, there was a lot of mix up back in the day. Y'all like the SOS of 2025.
Yes.
There's a lot of SOS too.
There's a lot of stuff I wouldn't say on the radio.
Yes, that's right. But you could tell her in person.
Exactly. About that, exactly. And I have to give thanks to also Joellen Thompson, Big Thompson's sister, who has the largest genealogy record of anyone in the island. And she has put a lot of stuff together for us. She has put a lot of stuff together for us because I didn't know some of the stuff until she started telling me about some of the stuff, and even some of my cousins who didn't know that they that their that their their spouses were McFields when they got married to them and so forth, because people didn't tell them that who their children would belong to.
Isn't that something? Wow.
Yes.
But yes, the people in the community certainly knew a lot of different things. There are people who own children that wasn't really theirs, and they'll be able to tell you, Gabby, go and sit down at the reunion and talk to Mr. McField and some others. So George said Mr. Steve McField is the second oldest living of the McFields on island. Isn't that fascinating? Wow.
Yeah, because and you see, a lot of people didn't know your father and farmer was like Jonathan and David and Jonathan in the Bible, and that's because they were family.
My father.
Yes.
Oh, really?
Uric, because Uric was a Solomon, and our great grandmother was a Solomon.
Okay. Wow. You see,
Napoleon's wife was a Solomon from Bordentown.
I certainly didn't know that. Wow. Amazing. I mean, I'm still trying to figure out how is it possible that I'm related to so many people from West Bay.
Yes.
Ebanks, because they're showing up all over my genealogy records and stuff as well. So incredibly interesting. George Fullerton says Bob Marley said that if you don't know your history, you will not know your destiny.
Exactly.
All right. Regina Barnes in the house says, looking amazing, cousin Steve. Yes, he looks fantastic. Per Island Pro says, say what? I know he's lying. 90. My God, let me live past the age of this awesome man. And sir, whatever it is you're doing, keep it up. So he looks amazing for his age. He's vivacious and has a lot of energy. Island Pro says he looks like he's in his 60s. Absolutely. He's really taken amazing care of himself. Justice will be served, saying that they ban education here. Now we see why Dart has taken over. Well, try and leave poor Dart out the conversation for one discussion, because I reckon he's the least of our worries on most days. Sarah says, don't worry about the naysayers. History will be kind to your writings. Please write that book. George says, Sandy, this is why you're so smart. George Bodden says, look at that. You're a McField. All right. Ms. Brenda says, listening to Dr. Steve is always a new education for me. It's amazing to have him on the show this morning. Good morning. Good morning to you, ma'am. And we also have quite a few people who are messaging us on WhatsApp as well. So give me one quick second. I'm going to read a few of these. Let me just see here now. So this person says, our history is indeed whitewashed. I absolutely love listening to Mr. McField. Thank you, ma'am. And yes, I mean, it's an amazing opportunity to know a bit more about your history. I think this is why it is incredibly important. So folks, if you think you're a McField, if you're not sure if you're a McField, there's only one way to find out. Speak to some of your elders, do the genealogy test. That might help put you in the right direction. And we want to say a big shout out. We have Susan. Is Susan coming on as well to say hello to us, Evelyn? I see Susan in the back studio.
I'm not sure, but could I ask Dr. McField to just basically tell us who Lemuel McField children were? And also I want to, while I on the mic, to say that, remember, December the 19th, 20th, and 21st. Those are important dates. Put them in your calendar now. I'm sure before we leave the show, give Vanda another opportunity to give the email. But if you could just talk about the Lemuel's children and then some other prominent McFields that people would be affiliated with to see who their grandparents, great-grandparents, or great-great-grandparents were. Yeah. And then people can then get an idea of whether or not they're family, they can start to feed information into that email. So Steve, if you could take that on for me, please.
There are different branches, so maybe it's important to talk about those.
Wilson, the oldest one. Baker. Buller, Worden, McField, Farmer McField, Mabel, Ashby that died, Warda, Warda Hunt, who else?
Orma,
Orma, Alda and Pearl,
Fanny,
Manny,
Fanny from
there,
Northside, Joey Ebank's mom.
Joey's mom, yeah, Richard, big man. And I think Lemmy had something like 14 or 15 children. And he also Edric McField, the pony, and them who lives in New York, Ashley McField and them family.
Kruger,
Also,
Rosewell, Kruger,
Rosewell,
my grandfather.
Old Daddy, Old Daddy. Yeah. I missed a few people. I don't know if
Aunt Pearl. There was one Pearl who lived in Cuba.
Pearl and Alda. And Pearl had two children, and Alda didn't have any children.
What about the other one in Isle of Pines, Steve?
And the other one in Isle of Pines, I think was she has children too, and then there's who else? And then there's few here I don't want to say on the radio until I confirm that it's okay to name them. From up in the east that were McFields, Mr. Yes,
Could you then talk about Mr. Shirley McField, who his parents would have
Shirley
been?
McField and them were Shirley McField and them were uncles to him. Miss Convillis McField, Irvin and the twins. They're all Ora McField and Ella McField and Woodley McField, who got lost on the Majestic in 1941 hurricane. His name is down in Hero Square on the plaque. Woodley McField, that was Louis McField and Ella McField and all of those Miss Lilla McField's husband. From that side, and then there's June McField who founded the Walton family, Stanley Walton and all of those people. Her husband Paula Bill McField, who was the keeper of the turtles in the North Sound. He had a house built over the sea in the North Sound. He was the caretaker of all the crawls for the Marins and the McTaggarts and those people. And there's so many of them, Uncle. Yes.
What
Miss
about
Brenda's
Teacher McField?
asking, what about Teacher McField's father?
Yes.
Pardon me?
Miss Brenda said, what about Teacher McField's father?
Oh, Uncle Timmy was Uncle Timmy McField was Lemuel's brother. Lemuel had several brothers. Lemuel had several brothers. Some of them never came back. That's David McField, I say, who was the ambassador to Jamaica and Nelson. David's son, who was the ambassador to the Organization for American States. You can look that up. And you could see they went off to Nicaragua. You remember Lillian McField was married to Del Seymour? She comes from that line of the McFields over there. And Uncle Timmy McField, Teacher McField's father, and Marjorie McField, who was married to Carlton Webb. They live in Tampa. Yes.
Wow. Well, Paul the man says, I love today's show. Island Pearl says, Sandy, I'm not a McField or related, but I could listen to Caymanian history for hours. It's just amazing to hear the facts, and it's much different than picking up a book. Interpretation.
Yes.
Different. So I can testify to the fact, because we've got over 410 people listening to the live stream. So I dare say that a lot of people are very, very interested. Danise says, my grandfather sorry, my grandmother was Lillian McField. So look at
That's
that,
right.
another family member right there.
Lillian came from one of Lem's brothers that went over to Nicaragua. You know, a lot of people went over to Nicaragua, and the Caymanians were in Nicaragua, just like how we say the Jamaicans and the Honduran and the Filipinos are here. They were the workers that were there in the gold mines. They were the bookkeepers, and so when Sandina came and run through and would get rid of the Americans and the Americans get rid of the Americans. A lot of Caymanians got killed. The Hislops. The gentleman who had the first light plant here was over in Nicaragua, Charles Hislop, and all those people were down in Nicaragua. And the Andersons were in Nicaragua, while Anderson's father and all them were in Nicaragua and in Panama. So Caymanians went everywhere. When they built their ships, and they went everywhere where they could find a better living. And they were formidable people, hard people, and they carved out a living for their families and so forth. And I tried when I was with the government for those 3.5 years on the McKeever's regime, when I was the advisor to the government, to the premier and the Ministry of Finance, Development and Tourism, and I was negotiating with the China Harbor for the build a dock in Georgetown. I would go to Jamaica several times, sometimes twice a month, and they would come down here. We would have negotiations and talk. I met David. David was the ambassador to Jamaica then, and I tried to get the government to. I didn't realize then that Sandra, Ms. Catron, that you had an ambassador cannot just leave his post. He has to and go to another country. He has been invited by the government, and I tried to get the government to invite him here as an official, and they wouldn't do it. The protocol office say, well, why should we do that? Blah 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 blah. And but now David now is retired, so I want to go down there to see them. So that I can see them. Not only that, but so that I want to do some trade between Nicaragua and Cayman. There's some food and so forth, with which they have a lot, because we buy a lot of stuff through them, but it goes to Miami first. So I am pursuing that angle too.
Wow. So incredibly fascinating. Well, we are at the end of today's program, but of course, folks, Marshall says that he knows a lot about Caymanians. He knows about Caymanians in Bluefield, Nicaragua. Again, showing the connectivity between a lot of the different countries and islands in the region. Ms. Brenda says Margie Webb, Nee McField, is Teacher McField's sister.
That's right.
Wow. So this is absolutely amazing. Jim says this gentleman is a blessing to his family and to the Cayman Islands. What a beautiful memory of history Dr. McField has to share. Amazing. Well, there's more to come, folks. Again, a McField clan family reunion. Talk to your parents, talk to your grannies, talk to your siblings who might be older than you that would know how you're connected to the McField. And if you're not sure and you don't know, come on out, please, and, find out, because I think it'd be great to really get a good fix on the numbers of how big the McFields actually are. So thank you to Mr. Steve McField, Evelyn Rocket, and Vanda Bowery, and myself, apparently. Yes, I knew that. All McFields. So really, really appreciate this initiative. And thanks to all of the other members of the family who are going to be helping to pull this together. Miss Joyce Ann says that that's where my mother's mother is from, Bluefield. So Miss Joyce Ann, who knows? You might be a McField too, somewhere along the line. All right, folks.
Could we please have Vanda give that email out one more time, please, so that people are aware of it?
Yes. Oh, you muted yourself, Miss Vanda. Just unmute yourself for me, please.
Sorry, my bad.
Yeah, are you going to set up a Facebook page?
Yeah, we're working to set up, different avenues of social media and so forth, so it's much easier for persons, to connect. Um, Save the date, December 19th, 20th, and 21st. That email address, McFieldFamilyReunion@gmail.com.
Fantastic. McField Family Reunion at gmail.com. Super easy. Look out for some social media handles to be coming here shortly. And thank you guys very much for this. Very, very interesting indeed.
Thank you so much for hosting us.
All right, my dear. Vanda Powery, Evelyn Rocket, and of course, the legendary Steve McField, who is, like I said, his memory at 90. Oh my gosh, absolutely amazing. Mr. Steve, promise me you'll sit down and do that Cayman Voices interview with me.
Yeah, I would. I wouldn't mind to do that. I would let you know that I have some stuff written already, and when I discussed it with a certain publisher, he told me that I'm looking to they would kill me if because I am not saying about I heard this and heard that. I am calling names and saying who is who and whatnot. Unlike Roy Barton, who writes around things, I go directly to the heart, to the meat, and publish the stuff that I know, because I know a lot of stuff that you would not believe what I know.
I reckon that we could have an entire show, which, by the way, I don't know if you know this or not, Steve, but I don't want to wear you out because, I mean, at 90, like I said, you have so much energy. You're more energetic than some 60-year-olds I know. But we're doing CMR TV here, and wouldn't it be interesting to have a segment, even if it's weekly or monthly, with Mr. McField talking about some of these things so we capture more of this oral history? Maybe we should talk because we're kicking it off for our 8th anniversary here at Cayman Mall Road coming up the end of this month. June the 30th is the official launch date for CMR TV, but we're taking independent content creators and putting them under a singular umbrella, and they can create their own content and talk about whatever they want. So maybe you and I should have a much broader conversation about how you could be part of that as well. I tell you what, it would be a very fascinating show, and people enjoy listening to you anyway. So why not?
Sandra, I get up 5 o'clock in the morning, sometimes 4:30. I especially when I'm on the radio, I'm in town like 5:30 in the morning to my office. And when I'm not there, I chair the Immigration Appeals Tribunal. Thursday.
Oh, looks like the connection was breaking up there just a little bit.
Cases that come up from the immigration board.
So we're having a little bit of interference, I guess.
I never think about it. To me, it's just the same. Today is just the same as yesterday, and yesterday the same as today. I don't know. I don't know. I think, Sandra, that it all came to me one time. I'll tell you about it when I see you.
Okay.
I'll tell you when I see you.
No problem. I'd love to have you to be part of this project, if at all possible, because really it's all about bringing Caymanians and other content creators under a single umbrella. So we do have a caller on the line. Good morning, caller.
Morning,
Sandra,
and I was just trying to get his number. Mr. McField is a world of knowledge. I just wanted to get his number. I want to touch base with him.
Yes, just WhatsApp me and I'll send it to you.
Sure. Thank you so much.
All right, my dear. No problem. Thanks too. So you might be getting a lot of phone calls now. I'm gonna get to him first.
Yeah.
Oh my goodness. So, but yes, George says, good idea, Sandy. Get it done. This is the kind of thing that we need to hear. Appreciate it. Miss Lisa says, be brave, and it's your time. Well, I'll tell you what, we've never had a choice, I suppose, Steve, but to be brave, I think that also runs in the blood. People might call us troublemakers and agitators, But
Oh yes, yes, Sandra. That's what they did. That's why they label us. They label us. They label the different families. Um, the families were known to dig wells and to make cisterns and to cut wood and to do this and to do that. And they said that we were always the troublemakers because we asked questions and we did take things for granted and we always wanted to have answers and so that we were the troublemakers. The
well,
McField.
somebody else is loving the idea. They said Mr. Steve having his own show is a great idea. So we're going to talk to him about it, and we can certainly make that happen. That is, you guys know me. If I say something, it's coming. So let's see what we can do. Like I said, subject to his schedule because he's still a very busy man, of course. So Miss Brenda says, see people, this is one of the last Iron Men that we have left, Caymanians. It's not late to know your history. Justice will be served says, wow, I'd love to hear that. And please call the names of my own Jamaican people back then who were complicit also. Protect this man at all costs when he releases his book. Island Pearl says, Sandy, can you ask him if he knows of any other family history in Cayman other than the McFields? Oh, he knows a lot of Cayman history.
Oh yes, I know. I know the family history of the Caymanians, of those who up until those who say they were Caymanians up until the 1970s.
Yep. Yeah, he knows a lot of history. Trust me, it's not just the McFields. Of course.
Their interactions and who they interacted with and who they worked for and what they did and whatever.
That's right. And we're also interconnected. I mean, to me, it's shocking. When I look at my genealogy again, the McCoys, the this one, that one, it's like all Caymanians ultimately seem to be connected back at some point or another. So it's fascinating. And even beyond your shores, you got to be careful. You go and find someone to marry in Jamaica, and it turns out they're your cousin. So like Evelyn would know, you don't want to go to Elizabeth.
You're also family to Miss Catherine. You're also family to Mr. Neville McCoy's grandmother, who was Irish, from Borden Town. You know that, don't you?
Oh no! I mean, this is all news to me. Wow.
Yeah. Okay. You ought to speak to him too, Mr. Neville McCoy, that owned a little shop in Borden Town there.
Okay. Wow. All right. Well, we're gonna get this going. But thank you so much for joining us. I'm just putting down his name now so I don't forget, because like I said, your brain is definitely a little bit better than mine. But thank you so much. Marshall says, yes, Mr. Steve knows about the entire Cayman and world history. So a real treasure. Pat says, as a Powery, I'm inspired to bring our family together. Thanks for this. Absolutely. Shaq says, I'm a Watler. I would love to know more about my family. So this is sparking. Evelyn, let me just bring you back into the studio. Evelyn, this is sparking island-wide desire for Caymanians to know who they are, from whence they've come.
That's what it should be about, and we're happy that we could be the catalyst to that. And we're hoping by the end of December to have quite a database, and maybe other families should be doing the same, because we do not want our history to be lost, stolen, or forgotten, and that's important.
Absolutely. Miss Carla Rodriguez says, Dr. Steve looks so young and sharp as a tack. He's an encyclopedia of information and history. Absolutely love listening to him. God bless. We have a caller on the line. Good morning, caller.
Good morning.
Morning, dear.
Mr. Mark, I have to laugh first. His brain is so good. He's looking so good.
Oh, yes.
I want to ask him, since his brain is so good, I had a case in court once with a policeman, and he used a word that I called him. And when Mr. McField in court with me, he asked the policeman, what is a horse? The policeman said, a horse is a horse. He asked him, what is an owl? He said, an owl is an owl. So all the taxi drivers, we run out court singing, a horse is a horse and an owl is an owl. Mr. McField, you're looking good. And
thank you.
Okay,
Thank you,
I
ma'am.
don't know if you remember that case. That was
I
years
remember,
ago.
yes. I remember, yes. I remember most of my cases.
Yeah,
Yes.
you take care now.
Thank you,
All right.
ma'am.
Thank you so much.
Thank you.
So, that's all the way from the UK. Joining us this morning on that call. All right, so thank you so much, Steve McField, Evelyn, Ms. Vanda, and the rest of the crew. I appreciate you guys very, very much, and we'll speak to you next time. Cousin Steve, I'll be reaching out to you in the next day or so.
Thank you very much, ma'am.
Okay, thanks, my dear.
Okay, thank you. Okay, bye-bye.
Bye-bye. All right, folks, there you go. Yes, lots of family history. And I think it's so wonderful that they're taking this initiative on to have this family reunion. And I'm also glad, as others are saying, that they're now thinking, wow, I should do this with my family. So it's a fantastic idea. Imagine if we had a Cayman-wide reunion, all branches of all different families. Oh my gosh, I'm not even sure what grounds would be big enough to host that many of us. But one day we'll have to really think about doing something like that, because you'll meet other people that you're related to as well. Thank you guys once again for joining the program. We'll be back tomorrow morning. Tomorrow is Wednesday. We'll be back right here in the saddle. Big shout out to all of our listeners who stayed tuned. I can tell when you guys are interested because the numbers are not dropping. We had about 420 people sitting there listening to this segment with Mr. McField, Evelyn, Vanda, and the rest. Really, extremely interesting. And I look forward to hearing more about the family reunion. Of course, as a McField, I will definitely be there, and we'll do some coverage on it, and we'll remind you guys as we get closer to that December date. So lots of pretty much 6 months now to plan and get this all organized. So reach out to them, pay attention. We'll post something up once they get the flyers going, social media, and so on. All right. As someone says, and remember to tell them, police, to talk to the people of Cayman. Oh, yes, I'm doing my best, honey child. Ms. Brenda says, Sandra, please bring these segments more often. Ms. Brenda, do not worry. We've got a cultural show that is coming under CMR TV. We have individual content creators. We have a young lady. I don't want to give too much away yet, but she's got an amazing show idea about Caymanians, the entitled. And I thought, ooh, that's going to be a good topic. So stay tuned. We're bringing you lots of very, very interesting content. And I think you guys are going to absolutely love it. And that's what I was saying, that I think Steve McField could certainly be part of that journey as well. We want Caymanians from all walks of life to really bring us together under the CMR TV umbrella. And radio, once we launch radio as well. All right, good folks. That's all she wrote. Y'all have a blessed day. See you tomorrow morning.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.